Welcome to Arirang TV's special coverage of COVID-19. I'm Min San-hee. Global interest in Korea's handling of the outbreak has been broadened to include its medical equipment. In today's edition, we take a look at K-medical industry, given the surge in exports of Korea's healthcare, that is, supplies, such as its test kits. But first, as always, we have our headlines with our Kwon Soa and Noaram. Welcome.
Hi.
Hi.
So let's start with our domestic updates then.
Well, we transitioned from the intense social distancing measures to everyday life quarantine measures yesterday, as we have been continuously seeing a slowdown of the spread here in the country. Now, for the third straight day, we have less than 5 confirmed COVID-19 cases here in Korea. As we can see on this graph, 3 to 4 in the past 3 days. And for a closer look at the government's updates as of 12 a.m. this Thursday, we have a total number of 10,810 cases here in Korea, and the death toll stands at 256. Now, more than 80 less people in quarantine now, and also more than 80 have fully recovered this Thursday. And out of the 4 new cases, 3 were reported as imported cases and 1 as a domestically contracted case.
And that, of course, being a very sobering reminder of the danger of domestic transmissions, right?
Right. Yes, that's why officials are stressing day by day. At a morning briefing this morning, also Yoon Tae-ho, a senior health official, mentioned how there remains unidentified cases, which calls for continuous vigilance despite the end of the strict social distancing measures we've been following until May 5th. He in particular advised the nation's people to keep wearing protective masks, whether it be KF-80 masks or cotton masks, especially when taking public transportation or visiting indoor multi-purpose facilities, despite inconveniences and warmer weather conditions. And speaking of indoor facilities, a new rising concern is the growing number of people going to crowded nightclubs and bars amid the decline in coronavirus infections in the country. A patient in his 20s from Yongin, Gyeonggi-do province who was confirmed with COVID-19 on Wednesday reportedly visited 3 clubs in Seoul's popular Itaewon district early May, among other facilities, and said to have had contact with possibly some 2,000 people. Now, while entertainment facilities are continuously following strict quarantine instructions from the government, these kinds of cases are raising concerns of secondary and tertiary infections, which is why individuals' hygiene practices and everyday social distancing is really essential at this point.
Right. On the global front, I understand India is on high alert as thousands of migrant workers have arrived home.
Right. This as that following India's easing of a lockdown, which was in effect since late March. Now, thousands of jobless Indian migrants arrived by train on Wednesday alone. Some 70 trains transported around 80,000 workers for the past 5 days, according to India's travel authorities. They came from various places around the world, like the United Arab Emirates, Saudi Arabia, the US, UK, Singapore, and Malaysia, where they were stranded due to the 40-day lockdown, which resulted in 122 million lost jobs in April alone, according to the Center for Monitoring the Indian Economy, with a record high unemployment rate of 27.1%. India now has close to 50,000 confirmed COVID-19 cases, with almost 1,700 deaths, and some 14,000 have recovered. Now, turning to Southeast Asia, the Philippines has surpassed the 10,000 mark in accumulated COVID-19 cases on Wednesday, with 320 additional infections, and the country is planning to implement new guidelines at its international airport in Manila for a so-called new normal to get prepared for lifts in travel restrictions. The Philippines is now the 3rd hardest hit country in Southeast Asia, following Singapore and Indonesia, with more than 20,000 and 12,000 cases respectively. And now let's take a look at the global updates in general, where we have major outbreaks. First off, 1.26 million cases in the US, followed by Spain and Italy. And the UK now surpassed the 200,000 mark, as well as with 30,000 deaths. Russia Russia's total cases are similar to Germany's, and Iran has over 100,000 infections. And those were the global updates.
All right, so thank you for that. I'll be back to you after the regular briefing.
All right.
Arirang, President Moon Jae-in is in his third year in office and is facing one of the biggest challenges in his term. How has he handled it so far?
Well, overall, it's been good. I mean, the Moon administration was quick to deal with the outbreak in the initial stages with rigorous testing and strict quarantine measures, as well as self-isolation measures. And the international community has also caught on to that, as well as the foreign press. They also praised the Moon government for its transparency during the epidemic. Korean test kits, drive-through test centres and mobile contact tracing were innovative measures that were also praised and have been dubbed K-quarantine, like the similar to K-pop as well. In the early stages, the government was in hot water, though. It wasn't all smooth sailing because there was a shortage of face masks, and the government was especially criticised for allegedly providing China with millions of face masks when Korea didn't really have any. So that was a bumpy road in the initial stages there. But with rationing of these masks and increased production, the mask shortage was somewhat alleviated, and now there seems to be a good production of them. However, it wasn't all down to the government. I mean, the Korean people also did have a part to play. The active participation and awareness of the Korean people helped the country turn the tide. There were a few exceptions, of course, especially with a few problematic religious cults and a few people violating self-quarantine and self-isolation rules. And the Moon administration's COVID-19 response had also proven to be a big help in the April general election, which resulted in the ruling Democratic Party having a landslide victory.
Right, it did. Now, talking about praise on Korea, France's Conservative Party, Les Républicains, has released a report on Korea's response to COVID-19. Tell us more, Aram.
Yeah, that's right. The LR's report says France should learn lessons from Korea's antivirus measures. The report also noted how Korea was able to keep infections relatively low without closing borders or imposing lockdowns like many other nations have done. The LR also mentioned how Korea learned from its shortcomings during the SARS and MERS outbreaks and was so able to effectively fight COVID-19 this time round. The report also hailed the civic consciousness of the Korean people and the transparency of the government as well as health officials. It also outlined how Korea's IT and internet connection speed, one of the fastest in the world, helped develop the innovative contact tracing methods such as the ones we've seen in smartphone apps as well.
Aram, we've been talking about this earlier. Well, that is before the broadcast. The weather has gotten unusually hot and there's much debate over whether it's safe to use air conditioners, especially given concerns over the spread of COVID-19. What are health authorities saying about this?
Yes, well, it would be nice to turn on these air conditioners, especially in these climates now. But Korea CDC is not advising against using air conditioners, but it is urging those who do use them to ventilate rooms where they're in regularly. The KCDC chief, Chun Eun-kyung, said there is still no concrete scientific evidence that suggests air conditioners will spread the virus further. That's been one of the major concerns of these devices. She noted that studies have been done in countries like China, but said those experiments were done without ventilation, so the figures could be a bit misleading. And Chung also said the government is still collecting opinions from experts on the matter of using air conditioners as well as air purifiers as well amid the pandemic, because air purifiers are also said to cause a further spread of the virus. But again, no scientific concrete research has been done on it.
I see. All right, Aram, thank you for that. We'll see you again tomorrow. Now, we take you now to the regular afternoon briefing by the Central Disaster and Safety Countermeasure Headquarters on the COVID-19 situation here in Korea. The social distancing campaign has now given way to the daily life or everyday life quarantine initiative. State-run cultural facilities such as museums and libraries are open, and sports leagues are kicking off their seasons this month in the absence of spectators, though. Schools are starting they're starting to open in phases next week, with high school seniors being the first to attend offline classes. Health authorities, meanwhile, are calling for continued caution and adherence to good personal hygiene and safety practices, including the wearing of face masks and the avoiding of crowded indoor spaces. As of early Thursday, as our Kwon So-ah pointed out, Korea confirmed 4 new cases of the virus, with one of them being a domestic transmission, that is, and the rest being imported. Earlier on Wednesday, the country recorded 2 cases, also all imported. We will come back to you after the briefing.
그럼 지금부터 We will now begin our regular briefing for May 7th. First, here is Mr. Kwon Jun-uk, Deputy Director of the KCDC. Let us now begin our regular briefing. As of today midnight, we will be updating you on the latest outbreak situation here in Korea. The total number of confirmed cases now stands at 10,810. This includes 1,107 imported cases from overseas. 90.4% are Korean nationals. And of the total, 87.1% or 9,419 people have been discharged following full recovery. Yesterday, we had 4 new cases, while we had 86 more people recovering, and we saw a decrease in the total number of patients. And unfortunately, we had 1 more fatality, so I extend my deepest condolences to the deceased and the members of the bereaved family. And the regional breakdown is as follows, and we have seen 1 case of community transmission in the Gyeonggi-do province. And all of the 3 other cases were imported, and they were from 2 of them were from Americas, and 1 from Pakistan. And as for the community transmission, this was in Gyeonggi-do province and identified on the 6th of May. And 1 more person, which is a contact of this person, has been additionally tested positive. And the locations where they have visited are being sterilized right now. And we are carrying out the epidemiological investigation behind these cases. Looking at the sources of infection during the past 2 weeks, more than 78% were imported cases, and 9 of these cases, which is about 8%, are the contacts of already confirmed cases. And the countermeasures headquarters, we would like to carry out the everyday life quarantine measures going forward, which is all about striking a balance between everyday economic life and quarantine measures. It is very important to have a distance of 2 arms length between you and other people, and please keep the coughing etiquettes while wash your hands, and ventilate your space at least twice a day. So please abide by the 5 everyday infection prevention rules for everyone. And as for the senior citizens and those with chronic illnesses, please take your medications that you have been taking on a regular basis, and please stay home. And if you feel sick, please consult with the call center and visit our screening centers. And even if you have to go outside, please refrain from going to crowded and indoor places. And as we celebrate the Parents' Day tomorrow, we advise the public to refrain from visiting the elderly people who are staying at the nursing hospitals and long-term care centers. In order to keep our country safe against the virus, it is very important to keep our 5 everyday quarantine rules, as well as these quarantine rules for the community, which entails the importance of designating a manager in charge of quarantine measures. At the same time, regarding the sources of infection, we have a message to the press. When you report on the contacts of the infectious cases, I believe you have your guidelines for the media, and we would like to highlight the fact that we need to reserve and we need to respect the privacy and the human rights of each and every individual. So please comply with these measures. And 1 message to the public is as follows. As we enjoy our daily life routines, this is a very valuable time at the moment that we are experiencing right now. And in order to maintain the status quo and to curb the further outspread is very important. The everyday life that we are enjoying right now today at this very moment was thanks possible to all of the the efforts put forth by the public and the dedication and sacrifice made by the medical staff members who are fighting on the front lines. Starting from mid-February, we had a big surge in the number of cases, and many people embraced the difficulties and discomforts of having their everyday routines as well as economic activities. And nobody would like to return back to that stage. And the quarantine authorities, we also are very alert. And the COVID-19 is a very complex disease. However, we can control the situation if we keep ourselves alert and vigilant. So once again, I would like to highlight the fact that we would like to emphasize that you need to keep a 2-meter distance to prevent the infections through droplets. And if you reduce the physical contacts, I believe we can reduce the risks of community infection. I believe this is something that has become very apparent now. And on top of this, to protect yourself, you can protect yourself by washing your hands for 30 seconds. And please refrain from going outdoors if you have symptoms. And after we return to schools, we need to watch our students and monitor their health conditions. And if they are tested at an early stage when they show symptoms, I believe we can successfully deal with any kind of outbreak. And however, the worst case scenario is our complacency, and all of the quarantine measures would be in vain. And these complacency is at the front line and the baseline of all of these measures, and we believe that we need to continue to be vigilant going forward. And please refrain from being complacent, and please be disciplined and vigilant in order to protect yourself from the COVID-19. And we have seen outbreaks at the call centers, at the communities, and the nursing hospitals. We need to never forget these. And the coronavirus can be spread very fast, and it's very highly infectious. And we believe that a sporadic outbreak is inevitable. However, if it leads to community infection, if we deal with the situation at an early stage, we can control and manage the system. This is what we have learned throughout our experience. And at the end of the day, the coronavirus can be overcome. And therefore, we should always remember of our past and experience. Thank you very much.
Right, that was the government's afternoon briefing on the COVID-19 situation here, and I have Kwon So-ah with a summary of the key announcements.
Yes, so KCDC Vice Chief Kwon Joo-nok referred to that one domestic case from Wednesday from Gyeonggi-do Province. I believe he was talking about that case we spoke about before from Yongin, and it looks like another person that was in contact with this patient from Gyeonggi-do Province has tested positive as well. So the facilities that the patient visited were sterilized, and an epidemiological investigation is going on. And Kwon also mentioned that tomorrow is Parents' Day, and people should try to refrain from visiting elderly at nursing homes as well as care centers. And as one of the new social distancing measures are to distance yourself from your loved ones physically while trying to, call them more often, make phone calls as well as video calls. So he was stressing again to abide by the basic 5 principles, which also include washing your hands, wearing masks, and also trying to sanitize whenever you can.
All right, so thank you for that. We'll see you again tomorrow.
Thank you.
Over in the Middle East, Kuwait has granted entry ban exemptions to Korean business travelers, the first of their kind since the country banned all international arrivals to curb the spread of the virus. For more on the events unfolding there, I have live on the line the Korean ambassador to Kuwait, Hong Young-ki. Hello, Ambassador Hong.
Hello, good morning. Thank you for having me.
Yes, it's afternoon there, it's morning, and I mean it's afternoon here and it's morning there. Ambassador Hong, let's begin with some information on the COVID-19 situation in Kuwait. How severe is the outbreak there?
while Kuwait government is taking very seriously. There came their first confirmed case on February 24 in Kuwait. Now the number is amounting to 6,300 as of yesterday. Given the size of its small population, it's a big number. I'm afraid it hasn't reached the peak as yet. Combating COVID-19, the Kuwait government is taking more and more stringent measures. Entry ban on foreigners, close of government offices, shutdown of all business activities, and partial curfew. It's serious.
I see. Earlier last month, Ambassador, that will be the 11th of April, the Kuwaiti government chartered a flight for some 200 Koreans seeking to come home and returned with 400,000 test kits. Has there been much interest in Korea's test kits in Kuwait?
Yes, there indeed is strong interest. The Kuwait government and business people have shown strong interest in importing our test kits. And finally, the Kuwaiti embassy in Seoul purchased 400,000 test kits from our manufacturers. Now it's in Kuwait.
Ambassador, what is Kuwait's view of Korea's response to COVID-19?
It is very favorable from the very start. Since March, influential local newspapers such as Arirang, which is the #1 newspaper in Kuwait, and Al-Qabas and Kuwait TV have repeatedly covered our stories in a very favorable light, covering it as a success story. Also focusing on our large-scale diagnostic tests and new innovative methods such as drive-through and tracing application. The Kuwaiti authorities and the Kuwaiti experts and professionals are very well aware of our ability. Also, they think our response system is kind of a model.
That is very encouraging to hear. I also understand that on April 22nd, the government here and Kuwaiti health authorities held virtual talks on COVID-19. How are the two countries working together in the health sector, Ambassador?
We are working quite closely recently. On April 22nd, more than 100 medical doctors and professors from the Kuwaiti side participated in the web seminar organized by the Korean government. On the same day, there was a very intensive video conference between our government officials and Kuwaiti officials and experts, sharing Korean know-how and experience. Our guidelines and manuals have been provided to the Kuwaiti side, and the Kuwaiti side translated instantly into Arabic language. It shows their enthusiasm. And this is a global crisis. It's not over until every country overcomes this matter in its own soil. I hope this kind of communication or cooperation will go on.
I hope so too, Ambassador Hong Young-ki in Kuwait. Thank you very much for joining us at this hour.
Okay, thank you very much.
방역과 경제 모두에서 글로벌 공조가 아주 절실해졌습니다. 우리 기업의 진단 역량이 글로벌 공조에 큰 역할을 하게 될 것입니다.
A silver lining, if I may call it that, the presence of COVID-19 for Korea is perhaps its exports of medical supplies. For more on this reality, I have Professor Justin Fendos from Dongseo University. Hello, Professor Fendos.
Hi, thank you for having me.
And I have Professor David Kwak from Chun University. Hello, Professor Kwak.
Good afternoon.
Professor Fendos, we'll start with you. As a professor of biotechnology, in your view, how advanced is Korea's biotechnology?
I'd say it's very advanced. Korea, especially the last couple of years, has been very good about producing a number of different products in different areas. Most importantly has been the pharmaceutical area, where they've actually been very good about making a lot of different types of generic drugs. And so there's been this, over the last couple of years, a large amount of confidence and also a developing reputation that Korea is very good at doing these kinds of things. Another area that has a lot of success is medical devices, so things like prosthetics or things for replacing joints, also heart monitors and things like this. A wide variety of different devices have had a lot of success being exported overseas. Generally speaking, in terms of the concepts for a lot of the Korean companies, generally they don't so far have not made a lot of new inventions, but generally they focused on making things that have already been invented but at a slightly cheaper price but with very high quality control. So that's really been very good, I think, for the Korean development.
And speaking of that, last month, Professor Kwak, Korea exported some $200 million worth of test kits to more than, I think, 100 countries. What is driving the demand for Korea's test kits?
So I would like to mention two different things here. One was that from the beginning of the pandemic, we prepared massive numbers of testing kits. And it showed the world that through the preparation, we were able to sort of mitigate the spread of the virus. And the numbers did matter as a factor in those. But also quality matters, meaning if it wasn't for the quality, if the testing kits were to be standard, we would not have succeeded so much. And through the exposures, probably globally, people saw that us having these many testing kits to track each one of the contacts and different individuals and having them be isolated, but also having seen that the quality of the testing kits clearly worked for them, I think the world saw that and was very attracted by it.
Do you share these thoughts, Professor Fendos?
Yes, yeah, I do. And actually, to add on to what Dr. Kwak was saying, one of the problems that a lot of countries have, especially for the really accurate tests, which are PCR-based, is that you usually have to have facilities to get the results very quickly. And a lot of countries either lack these, or like in the United States, they have them, but they haven't adequately repurposed them yet. And so the advantage of the kits is that you usually don't need these facilities. The kit will just give you the output directly. And so one of the problems we've had in the United States lately is that you can get results, but because the facilities are either undermanned or not being run properly, you don't get the result for like 3 or 4 days, which isn't very good for trying to do a control or a containment procedure.
And before we continue now, for a better understanding of the facts and figures behind Korea's exports of medical supplies, let's take a look at this next report first.
Demand continues to grow for South Korea's bioproducts amid the COVID-19 pandemic. The country's medical supplies have seen a surge in demand around the world. Especially South Korean COVID-19 test kits are in high demand due to their accuracy and speed. A number of countries have requested them as exports or humanitarian aid.
PCR 시약으로 알고 있고요. 4월 10일 날 이미 한 차례 15만 건이 일단 수출이 되었고.
Test kit exports, which stood at $3,400 in January and $643,000 in February, spiked to $24 million in March. In April, they jumped eightfold to $201 million. Diagnostic kits are opening up opportunities for the country's export sector, which has been hit hard by the COVID-19 crisis.
이스라엘도 100% 저희들 거로 하고 있고 많은 나라가 지금 저희들에만 완전히 의존하는 국가가 되게 많습니다.
그런데 그 사실을 국민들이 알면 훨씬 더 자부심을 갖게 되죠.
They are being shipped now to 106 countries, with Brazil accounting for the largest share at 12.3%, followed by the US at 9.9% and Italy at 9.5%. South Korea's test kits are the product of technological innovation in the biosector and the government's quick approval. Other medical supplies in high global demand include protective suits, disposable gloves, and hand sanitizers. Exports of protective suits soared from $1.6 million in January to $19.5 million in April. Hand sanitizers and drug products also saw a rise in exports during the same period, from $540,000 to $44 million, and from $57.2 million to $98.1 million, respectively. The South Korean government is stepping up efforts to develop vaccines and drugs to fight COVID-19.
이제 방역과 경제 모두에서 글로벌 공조가 아주 절실해졌습니다. 우리 기업의 진단 역량이 글로벌 공조에 큰 역할을 하게 될 것입니다.
Swift response and technological innovations are taking the country's bio industry to the next level.
Right, Dr. Kwak, Korean test kits secured the emergency use authorization from the U.S. Food and Drug Administration. Tell us a bit more about what this emergency use authorization is and how does it differ from the normal approval process?
Right, so let me begin by explaining what the normal procedure looks like. When a certain pharmaceutical company requests for an approval from the FDA, it can take two different ways of the tracks. So it can take the faster track and go through a 6-month period of being tested for their efficacy, the safety, and testing to see if they're as effective as they claim to be. They even go further to examine if how much of the dosage it reaches inside the blood of a person. It can also take a slower, even slower track and take a little more than 10 months or so of time. There's also another track called an expedited track, which is a track when comes into place in cases of emergency cases, illness that has high mortality, very severe illness that is without a cure. In that case, they could expedite the process so that they could be somewhere in the middle and not go through all the way with the process. But what we're talking about here, what's called an EUA, Emergency Use Authorization, is not any of those three. It's more of an authorization made by the commissioner of the FDA for in a situation like that threatens national security level. So in cases of COVID-19, because the globe is going through it all together, the commissioner allowed certain kits and certain drugs to be used even without any test. It's an authorization made from the person, but it is going through without a specific approval from the committee of the FDA.
I see, and this is because of the severity of COVID-19, of course.
Exactly.
Professor Fendos, orders are piling up for other Korean healthcare supplies as well amid the shutdowns in the US and Europe. What are some of the other items that are high in demand?
Yeah, unfortunately, it's really everything. So if we just take the US as an example, I mean, the US is short on everything. They're short on the full body protective wear, they're short on masks, they're short on gloves, they're even short on vials, glass vials to put medicine in. They're also short on the cotton swab, so they're really short on everything. And then if you look at it globally, again, there are a lot of countries. Indonesia has gotten on the list now, Philippines on the list. So for better or for worse, Korea, because they've kind of controlled the situation for now, there are a lot of opportunities for them to export their products to these countries.
Professor Kwak, many Korean firms have also secured contracts for clinical trials. What is the general perception of Korean biotech firms worldwide?
Well, it had all along a very high reputation for their technological advancements and also the quality that they could put out. But what attracted the foreign clients more recently, I think, is probably due to the fact that we were able to show a very good results out of it. Not meaning the positive results for the testing, but more so it's in its transparency and its accuracy of the testing by itself. I think we're talking about more of a preclinical trials rather than the clinical trials itself, because clinical trials involve actually injecting the drugs into human beings. But instead, what the foreign clients are being more attracted to these days are in an animal models and etc. So they would be searching for lab settings and clinical researches that has a lot of experiences with English-speaking communities, such as those in the United States and those in other European countries possibly. But Korea had that all along. And so we were ready to provide them with such services on demand.
And Professor Kwak, going with what Professor Fendos mentioned, Korea's strategic handling of COVID-19 has seen a surge in exports of most of its medical supplies. I'm sure you agree as well. And what supplies, in your opinion, are gaining much popularity?
Well, I've recently saw on the news that there has been a great increase in the exports for personal protective equipment, and also possibly the hand sanitizing materials and surgical latex gloves and etc. To my knowledge, if I'm not incorrect, there has been a 7,000% increase in the exports of the gloves and sanitizing materials. These again, through the exposure, through the well management of the mitigation of the virus in the past, through the pandemic, I think we were able to show the world that our stuffs really worked here. Our stuffs really came into place when we had to go into the hospital. I just remember this particular scene from the news that in Daegu, when they had an emergency cases, a lot of the medical personnel were walking into the hospitals wearing all the level D coats and whatnot. I think that showed to the world that we were doing very well with the equipment of ours. Yeah.
Professor Fendos, there are reports that Korea is looking to export a monitoring system for COVID-19 patients. Tell us more about this system.
Sure. So the most important symptom of COVID-19 is the difficulty with breathing, and that is also the #1 cause of death. And so what you would like to do ideally is you would like to be able to monitor the blood oxygen level of all of your severe patients, because the blood oxygen level can drop very suddenly, even in the course of like 30 minutes or an hour. And so the device that you use to monitor this is usually called a pulse oximeter. Now, Korean hospitals are very good about usually regularly buying the newest equipment, so you'll rarely find things that are older than 10, 15 years. But in countries like the United States, for instance, you'll regularly find a lot of hospitals that are using equipment that are 20 or 30 years old, sometimes doesn't work very well. And also in the US, because they're using older equipment on average, they tend to be using two types of oximeters. The first type is what you call a mounted oximeter, which is something that you find at the head of a patient's bed. And if you watch Korean dramas that are medical dramas or have had surgery, you might have seen this, where they stick a little thimble-like thing on your finger. That's what's monitoring your blood oxygen level. The problem with those beds is that they're usually pretty pricey, and so in the US, most hospitals don't have a lot of them. So what they try to get by with are these handheld units. So nurses literally have to walk around and one at a time go and check the blood oxygen level of their patients. The problem is this takes a lot of time and energy away from the nurses, especially in a pandemic or epidemic situation. You'd prefer them doing other things. But also, you don't get a real-time tracking, because the nurse might make rounds 2 or 3 times a day. And so the times in between, you don't know what's happening. And so what has happened in Korea and some of the other countries that have the luxury of developing these devices is they're trying to create handhelds that will either be harnessed on or belted on, so that patients can wear them all the time and even walk around. And so if the blood oxygen level drops suddenly, there's an alarm that goes off, the patient knows, and then any of the caretakers also know at the same time. So it's a very thoughtful and interesting solution to a very important problem for COVID-19.
I see. Professor Kwak, speaking within your capacity as a medical expert, what are your thoughts on this monitoring system?
So I think it'll be very helpful in the clinical setting. There was a concern for medical doctors facing this sort of big, large-scale pandemic, because ordinarily a doctor would care for, let's say, 15 to 20 patients at a time. That's the usual number that we would think of. But in the pandemic like this, the cases that we faced, even in the States and other countries, doctors suddenly had to take care of 100 or more patients all at once. And that causes a problem, because a doctor within his or her own capacity, we're not able to focus on individual patients each day. With these machines, and implementation of these machines, it'll help greatly with the doctors, especially because let's say, for example, in a case of COVID-19 patient, the progress of the disease is thought to be very quick. Meaning a person can be very normal in the first day, but suddenly turn very ill on his 3rd day or 4th day. And doctors could not possibly check up on them every day, every 100 of them every day. But with these machines, when they have it attached, and it automatically notifies the doctors or medical personnel once there's a change in a vital sign, they will be notified, and we'll be able to pay them great attention right away.
I see. So a patient could be okay in the first hour, and then within half an hour, the patient could become very ill.
Yes, in rare cases. I see.
Yeah. Professor Fendos, how far are we from finding a cure or perhaps a vaccine against this virus?
Okay, so lots been happening the last couple of weeks. Unfortunately, we don't have any really big news that we could be really happy about. So on the treatment side, unfortunately, a lot of drugs have been added to the list of probably don't work. There's still hundreds out there that are being tested at various levels. The one bright spot that's pretty convincing was remdesivir, which is the Ebola drug that's been repurposed for COVID-19. And it looks like that does shorten the length of the severe symptoms by about 4 days, so from 15 days to about 11 days, which is good. But we still don't have convincing evidence yet that it actually helps with survivorship, with the patients actually not dying. So there's still some more work that needs to be done, but it looks like it's going to help. But other than that, the treatment side has been unfortunately pretty quiet. On the vaccine side, I have a lot going on. Generally, it depends on which types of vaccines you're talking about. So the first type, the conventional, traditional type, is where you try to create a lot of virus protein or a lot of dead virus, inject into patients so that their immune system can recognize it and develop immunity against the live virus. And for these, the rate-limiting step so far has been that we're having difficulty creating large amounts of this protein or large amounts of virus that we can then go kill. So the conventional way that's in the US that's been most common is to inject virus into chicken eggs, and then the virus will hijack the chicken egg system and then replicate itself a lot. So at the end, inside each egg, it's essentially chock full with virus. And then you take that virus, kill it, and then dose it out into vials and give it out as a vaccine. The problem is COVID-19, for whatever reason, doesn't want to use the chicken egg protein system. So it won't replicate itself very well in there. And so the conventional side, that's kind of been what they're working on, trying to get a way to create large amounts of dead virus. On the other side, we have the more experimental side, and this is where the Trump administration has put in about $1 billion committed to a company called Moderna to develop another technique. So instead of having the viral protein made outside of our bodies, we try to make it inside of our bodies. And this depends on being able to deliver a molecule that's called mRNA into our cells. But it's trickier than it sounds, because if I eat mRNA, it's going to be destroyed before it ever makes it into the cells. Even if I inject it, it's going to be destroyed before it makes it into my cells. So the issue here is in trying to deliver that mRNA molecule to our cells, and usually what you do is you encase it in synthetic fat, synthetic lipid molecules. The problem is these lipid molecules have side effects. And so at this point, we're kind of in that stage of doing trials and trying to figure out how can we get good delivery, but also how can we make sure that people don't get side effects. So there have been some other studies done before. Moderna did one on the Zika virus last year, but the most successful one so far was done by a company called CureVac, where they were looking at a rabies vaccine. And for that one, it seemed like it worked pretty well. About 2/3 of the patients developed acceptable levels of immune response. But the problem was there were some pretty high levels of symptoms, things like headaches and fever. There's even one case of something called Bell's palsy, which is where the muscles in the face relax and it looks like your face is drooping. So these kinds of things are things that need to be worked out before these experimental types of vaccines can really be put into large-scale use.
Mm-hmm. Professor Kwak, what should Korea do, in your opinion, Korean biotech companies, to take Korea's bio-health industry to the next level?
I will speak very generally. I think at this stage of the pandemic, because we're seeing a huge decrease in the numbers and we're really stabilizing, the next step we can take is probably to prepare ourselves for the possible second wave of the infection. From the history, we learned from Spanish flu in 1918, sadly, that it came not just in one wave, but in 3 different waves. But the saddest part about it was that it didn't kill the most people with its first wave, but instead with its second wave. And that's what we're currently being scared of and worrisome about. So I think still keeping individual sanitary measures, social distancing measures, even when the governmental restriction is lifted, will be the best bet at preparing ourselves and also coming up with other possible solutions and vaccinations and whatnot. But also, having said that, I think we now need to look at how society would work better, especially in the senses of economy. Without the economy, there would be no vaccination. There would be no treatments available. So we have to get it going back. And the faster we start to jump back at the normal level of life, I think it'll be better for us. But in all those, we need to carefully look after the more needy people. So I think those are the 3 steps we could possibly take right now.
It's interesting you mentioned the economy. That's something we'll be dealing with on Friday.
Oh.
Well, thank you, Professor Kwak. And as always, thank you, Professor Fendos, for your thoughts as well.
Thank you.
Thank you.
Right, that brings us to the end of Thursday's edition of COVID-19. But do join us again tomorrow at this hour as we'll talk about the chances of Korea playing a tangible role in restoring the global economy amid the pandemic. In the meantime, do reach out to us with your thoughts and inquiries on our social media accounts or our homepage arirang.com. Thank you for being with us.